And please welcome to the stage the next team, Team DataSAM.
Hello, everybody. I hope you can hear me well. Good. Yes, my name is Michelle, and today I'm representing for Team DataSAM to introduce you our solution to help hospital. How should it work? Okay, good. First, I have the question. Do you remember when was the last time you visit hospital? Yes. How long do you have to wait there? 12 hours? That's a lot. 30 minutes? You should buy a lottery, then you are so lucky. Yes, okay. From my own experience, when the last time, first, I need to wait for 2 hours to see the doctor. And after 2 hours, super tired, the doctor tell me that, okay, the nurse will give you medication soon. And after that, you can go home. I was so happy because it will happen soon. And that soon led me to wait inside the building for another 3 hours. With 5 times knocking to the doctor room asking where is the nurse, and then the doctor needs to call the nurse for a few times. So it's obviously there's several problems in the hospital. First, about the waiting, and then second, about the communication. And because hospital is so complicated system, at the moment they are facing with a lot of difficulties to manage their time, their information, and their resources. During the last year in our research, we found out a few, less than 10 when we group them together, hospital problem. And then, well, we don't need to go to those problems one by one, but there are certain things I can, for example, like the patient flow, how the hospital can reduce the time the patient stay inside so that it can give more space for the next person coming, and then how the hospital can maintain, can make sure the communication between the staff, the nurse, and the doctor and the nurse and the patient. And sometimes the hospital can have very practical problem. For example, expensive item goes missing. There's some tiny equipment go missing, like one bed have disappeared somewhere and then nobody have any idea where it is. It's just one day the whole IT system stopped working and the doctor basically cannot access into patient information to get any medication. So the challenge we are giving by our client is that hospital is having problem. Healthcare is getting expensive. Fix that. And according to the design process we have been learning from those problems, we need to focus on one or two and then try to make the solution with that. But our team is so ambitious that we try to think like, is there any solution that potentially solve all kind of problem there? Or at least in the future, the solution will enable hospitals to work better as a whole system. And today, I'm happy to introduce you to Aalto, a real-time tracking system, RTLS, as a solution for the future of healthcare. And what is real-time tracking system? Basically, in another word, it's called indoor tracking, or you can know that it's like GPS for inside building, that the system allow you to define the location of person or item inside the building. What the system actually mean in practice, that you will have a task, can be this size, can be actually a bit smaller. Oh yeah, thank you, Jonas. Yes, this is how the future of the task should be. And then the task will be attached to item or will be carried by people. And of course, only one task doesn't do anything. Then you need another thing called the receiver. This is the receiver, and the receiver will be plugged into the wall with the power socket in the room. So basically, the receiver knows the location, like which room is inside. And when there's the people with the tag or the item with the tag enter to the room, then the receiver knows. From that, the system will know the location of the tracking object. And the system we try to implement here is scalable and easy to install. Like I just tell you, that you don't need to be an IT expert to install that. You just need to take the receiver, plug into the power socket, and then magic will happen. and then, like for hospital, when they want to install something new, there's a problem that if they put something into the home building, so it will be expensive. With our system, that the hospital can implement in 1 room or 2 rooms from the beginning, or 1 emergency department, for example, and then they can have the test, and then after that, they can scale it up based on their need. So because of that, our solution have 1 big benefit, that's low initial investment, and then it's really easy to monitor and update, and it doesn't require any extra device to use. So in the end, it's a low-cost system. And as I say, it's tracking system, so then it can enable the hospital to track the high-value items, and then to track people, patient, and staff. What the tracking system will have the hospital problem that I mentioned before. For example, the hospital would know how many beds they have been used or what kind of resource they have, and then they can utilize the resources better. For example, when the hospital track the staff, so then they can enhance the staff security. Or when the hospital track the patient, they can monitor the patient status and provide a better health care for patient. There can be 20, 30 different applications that our system can deploy. And in this ME310 year, we developed only 1 application as a demonstration of the utilization of our system. Remember the tag? This tiny one? When you put it into the wristband, and then as a patient, when they visit the hospital, they have that one as the patient wristband. What that patient wristband will help them to make their stay in hospital nicer. I would like to invite my team member, Jonas. He will show you a demo of our patient application.
Thank you, Michelle. You will surely help me out here a bit.
For sure.
All right, everyone, I'm going to try something daring and try to demonstrate it to you live. Okay, so Michelle, if you would like to show the interaction, how the user would actually interact with the tag.
Yeah, the nurse give me the tag, and the nurse tell me that the tag has my personal information, and I can access to those information with my mobile phone. And the good thing about that is that I don't need to install any application in my mobile phone in advance, because the tag will act like an access key to the application just by putting the tag close to the mobile phone like this, and then the application will open with the web browser in the mobile phone. And yeah, for easier to use, so we show it with the computer.
So this is actually a mobile application, but let's see if it works in a desktop browser. So when the user enters the hospital and scans the tag, the application shows the estimated waiting time, and the user can set, for example, notifications to ease their waiting anxiety. This is because of the fact that when we researched the #1 hospital problems that the patients have in hospitals, the foremost issue that the patients had was waiting, and the problem was that they didn't know when the waiting ends. The other problem associated with waiting was the fact that the patients had to pay constant attention to, for example, waiting numbers or listening to their surname being called. So With this, if you get push notifications and vibration alerts, you don't have to pay constant attention. You can even go mind your own business while you get constant updates of the estimated waiting time. The other features, of course, include seeing your own patient journey in another tab, so you can access the information that you had earlier. Or you can, for example, locate yourself in the map. So where am I? I'm in exam room 121. All right, so when we this application was basically developed with the given feedback from the main users, which are the patients, and with the hospital staff. So we interviewed many head nurses and many head doctors to actually ask them what sort of information would they be willing to share to the patients and what sort of information is there available in the hospital systems. And actually it turned out that they were really enthusiastic about sharing information with the patients, because the hospital staff actually feels the same miscommunication problem as the patients. So over here you can see, for example, test results from different tests. All right, of course you can leverage this application as a platform for many other information as well, telling about the hospital services around their cafeterias and such. But for this prototype, we have been concentrating on the waiting times and easing the waiting anxiety.
Okay. He said that it would come back. Yes. Okay, so in a nutshell, the patient application is, remember, it's just an example demonstration what the system can be done. So yeah, we aim to provide more information for patients to enhance the patient experience, and at the same time we want to get the communication part between hospital and patient. And we did, like Jonas said, that we did the application and via our user research. And then this is some code from the testing that we had. Like first time when we had the idea like to create a patient application, we have the mock-up prototype, we have the mock-up version, and then we bring to the hospital, we show to some patient who's waiting there and ask them about their opinion. There's one elderly lady, she just said like, this is so awesome, I wish it could happen, but it's impossible. Yes, and then last month when we have the app like more polishing, and then we visit the hospital again, we show to one 20-year-old boy, and then he was at me like, okay, so that's so good, and when will you have this one? And I'm like, our project will end in a month, so then we will have that to use in a month, right? Yes. So I think that is kind of draft up like the benefit, the real benefit that our application can actually provide for people. So our vision is to create a low-cost, easy-to-use, and patient-centric indoor tracking system. You are welcome to visit our stand over there in the loft to try it out yourself, the interaction between the tag and the mobile, as well as like to have a closer look with the patient application. And we can also discuss more what kind of different application hospital can use for. Thank you.
Again, time for questions. George.
Hello. I was just wondering, what technology did you use to accomplish the indoor tracking, and what is your resolution? Plus, what is the battery life of those things?
Can I answer that?
Yeah, we don't need the catch box. Yeah, oh, you want to?
Of course, I want to. Well, like basically, as you know, that we have signed the NDA with our client, so there is some part that we cannot disclose here. In case you are interested in, you can discuss secretly with us in our booth.
So you can't even say how accurate it is?
All right. So initially, our brief was to reach 2 square meter accuracy. But according to our research that we did early on in the project, it turned out that hospitals really don't need to know in 2 square meter accuracy where a hospital bed or a patient is. So it turned out that we need room level accuracy. And that's basically what our system can deliver. And I wouldn't promise anything more than that. About the battery life, well, if you believe the math, it should be around 10 months at max when you do all the configurations correctly. However, as you probably can guess, we haven't had actually 10 months to test whether it actually lasts.
Cool, thank you.
Question in the front.
Hey, thanks for a great presentation. You say there that the most
Thank you.
important thing is for the patient is to know what the waiting time is. My question is, how do you know what the waiting time is?
Ha, good question. That's that's interesting because, of course, we use the tracking tags to track the patients at their different points in the patient journey. And as you can probably guess, with this information, we know how many patients there are in the waiting room. Of course, there are unpredictable situations in a hospital, such as some cases are more critical than others. But this information is also readily available in the hospital systems. Whether you like it or not, I mean, it's not actually public knowledge, but they do categorize you in about 3 different categories, and we can utilize those categories to calculate the mean waiting time in those categories.
Thanks.
Hi. One of the things that is it working?
No,
Did we
can
break
you
it?
put it
No.
closer?
Okay. So in my country, you are only allowed to take someone in if you're under the age of 16 or so. Otherwise, you need to go on your own as a patient. So would you consider sharing the app with family? For example, the moment you walk into the hospital, you could text like a code or something to your family so that they know where you are, that you are waiting, and hence reduce family anxiety and the number of phone calls that are placed to the hospital to find out about the patient.
Yes, that's definitely something that actually crossed our minds, and some of the patients gave direct feedback to us regarding that. They would like to actually have the features that if they're only visiting someone or if they have children, for example, that they could get notifications. But due to some legislation issues, like it's different legislation in different countries, and the controversy behind that, we didn't want to take that as our main focus. But definitely I would consider to implement something like that.
Thank you.
More questions, anyone?
I'll just throw it at you.
More questions? Oh. Nice, Joni. This is for you.
Hey. How do you deal with the patient's knowledge and information that they gather from the tests, security-wise?
Yeah, so basically the first steps are not personal information, like the waiting time, the queuing number, so you don't need to log in, so you don't have any personal. But after that, you get the laboratory tests and the results and diagnosis. At that point, you would have a login there, and then you, with bank credentials, for example, and then you get access to it, and we don't store any data on that server, so it's on that application, so it's on hospital sides. And when you leave outside of the hospital, we erase the information, so there would be no security brief on our service. So it's provided by the hospital, which already has it. So we try to minimize the security.
Thank you.
Hi, great job, guys. I can't wait for this to become reality. It's pretty cool stuff. What do you think is the biggest issue why this hasn't been a reality already, and what do you think would be the time frame for it to actually be?
Okay, the biggest issue why it hasn't been reality with the other company is money, because they use similar but a bit different technical technology. So basically, the hospital, when they want to have the tracking system, they need to have for the home building. So it would cost like $1 million, and no hospital would like to invest $1 million to anything that they are not sure whether it would work or not. So that's why our solution that we try to make it scalable so that hospital can start with one department, from the beginning, and then see whether it would work. So in case they would like to implement and develop further.
So it's mainly been a cost thing.
Yes. Even when we talk about patient-centric, but when it goes to management side, so it's all about cost.
Thanks. Over here.
Just quickly, for a hospital to integrate with this system and to start using it internally, what kind of a technical requirement is there for them? Because I understand a lot of hospitals have different systems that they use in the back end.
Well, as I know, at least I know, the hospital IT infrastructure is very fragmented. So the plan is to actually provide that application as a standalone, at least some minified version of it, which would require minimal integration with any of the existing systems. But of course, in order to provide information such as lab tests or other confidential patient information that's actually stored in the hospital databases, some sort of integration is required. But that's pretty much case by case depending on hospital. There is actually no general IT system structure in hospitals, so it's really difficult to say anything in general. It depends on the case.
So then how much manual work is there for doctors and nurses to click patients through this system?
There would be minimal manual work, like at least for the features that I was presenting over there, I don't see any reason why doctors or anyone for that matter had to click anything manually just because of our system.
So it would be attached to their own internally somehow?
Yes.
Okay.
Okay, thank you for great questions and answers.